the phrase, "You're too young to be my doctor." My name is Dr. Rich Hilsden. You're watching my channel, Knife Skills. I want to talk today about that phrase, "You're too young to be my doctor." If you're at all new, or you're a trainee, you're a resident, you're a med student, even if you're a new person working in a field of your expertise, you could imagine a lawyer doing their articleship, or maybe a young sort of associate. If you're someone like that, you may get that expression or that statement, "You're too young to be my doctor, lawyer, nurse, accountant," regardless of whatever your field that you're working in. You might get the expression, "You're too young." And I know from my own personal experience how sometimes that can be frustrating. You might get feelings like you're being judged by the person you're trying to provide advice to. You might feel like they may not respect or value the information that you're giving them. And you might feel a little bit, I don't know if it's self-conscious or maybe frustrated that you're being judged essentially by your appearance. And I can understand that frustration. I think it's worthwhile taking this video to really explore that and how you might feel, and really how you might maybe reinterpret the feelings if someone says, "Hey, you're too young to be my doctor." This video is actually inspired by a comment on another video, and I appreciate every comment, by the way, that you post. It makes making these videos worthwhile, and I'm really enjoying engaging a community online. But someone did post, "Oh, you seem young to be a doctor," which is truly, at my stage in career, on the humorous side. I've been working in the medical field now for almost 18 years. I've been in independent practice for more than 5. And I'm also more than halfway through my life. And so being told that you're too young, in my mind, is a little bit humorous. I mean, I'm absolutely at the peak of my performance when it comes to my profession. And yet, even in my situation, although I must admit, that's happening a lot less than it used to. Even in my situation, you'll get from time to time, "You're too young to be my doctor." I can't believe how young our doctors look these days. So if you're in training, or you're newly graduating, or whatever you're doing in your field, you're starting your practice, you're building your own identity in the field, you might get that expression, "You're too young." So how do you handle it? Well, first of all, I think about it from the patient's perspective. For the most part, that type of phrase is a compliment. They're trying to find a way to show you, "Oh, you look young." Our society certainly values youth. People invest money in looking younger. There's a lot of media attention on and commercials and things like that really focus on youthful looks. And so if a patient's telling you, "You look too young to be my doctor," I think more often than not, they're trying to pay you a compliment in that moment. And so there's an opportunity to be gracious, say thank you, appreciate it. I usually joke around saying, "Well, I'm not quite as young as I look," or I make a comment about maybe, thank my Botox, thanks my injectionist, thank you whoever's helping me look so young. But I think it is a compliment they're trying to pay to you. And so take that moment and really appreciate what the patient's saying when they're saying, "You're too young to be a doctor." But I think another way to think about it, and maybe can help that understanding of that phrase, "You're too young to be a doctor," think about it from the patient's perspective. Oftentimes when you're seeing a doctor, you're in your office or you're in the hospital, whatever the context is, patients are seeing you for a problem. Their health maybe is failing. Their health isn't as good as it used to be. And there's nothing that makes you feel older, I would say, than having something impact your health, having a negative hit on your health. There's nothing more impactful, I would say, on how you feel about yourself than loss of your health. And so the patient actually may be feeling more self-conscious on their own about this. They might be actually expressing their own feeling that, in this situation, I'm feeling pretty old myself. I'm feeling old because I'm unwell. I'm feeling like I'm vulnerable because I'm sick and unwell and you're taking care of me. So oftentimes it comes from that patient's place of insecurity. So recognize that as well. And I think, although there's no really easy way to address that or identify that, if you're getting that comment, you're too young to be my doctor, recognize where it's coming from the patient's point of view. I think people can feel a little self-conscious about being judged by some external characteristic when it comes to their professional ability. No one wants how they look, maybe the gender that they identify with, maybe the way they dress. Certainly I've got colleagues of mine with like sleeve tattoos and things like that. Those people for sure, and myself included, don't want to be judged, don't want their professional competency to be judged by their appearance. And yet, without a doubt, patients will express that and experience that. Oftentimes, we're dealing with a generation gap. If you're a young or middle-aged doctor, you're going to be treating people at the later stages of their life, at their end of life. And they're going to have different experiences that they've had that they bring to the table, that their biases, their perspective on the world is going to be very different. And so oftentimes some of their communication it could be offensive, it could be awkward, but you're in a position of power in that relationship. You're in a position of authority as a doctor. And as much as you want the patient to fully buy in to you being the authority, sometimes it can be difficult for them, and they're going through that process, and they might express that by a comment they make to you. So I think it's good to have a sense as to how to handle that psychologically when that happens. And I know for me personally, when I was a junior doctor, I would get those comments, and they would be challenging to handle. It does change over time. Obviously, we all become older. We all age, and so over time, that becomes less and less. And without a doubt, there is an end of all of our practice. Eventually, we do become too old to be a doctor. We eventually do become too old to do the job that we want to do. It is an inevitability, especially in healthcare, especially as a surgeon or most medical professionals. There is an end state. You just can't do this job forever. You have to retire eventually. And so being complimented on your youth sometimes may be hard to take, but is truly a compliment that you can hold to yourself. So that's my advice. Recognize it as a compliment. Recognize that the patient may be going through their own thing and may have their own biases. When you hear that expression, you're too young to be a doctor. My name is Rich Hilsden. I'm a trauma surgeon. You're watching my channel, Knife Skills. Thank you.